Now, what I have here on this screen, a lecture based on medical and scientific evidence, meaning this is not opinion, this is not anecdotes, this is what real medical and scientific data. So no BS here. Disclaimer, you can all read it. Then this is what I do. I'm the editor-in-chief for 4 medical journals. I'm a reviewer for Journal of Immunology Research, and I'm on the editorial board of various other journals, etc., which gives me the opportunity to see everything that's gonna be published before it's published. And then all the information here is to educate. I don't make money off of it. I don't want to profit in teaching and helping doctors, clinicians, healthcare practitioners who then go and help other people in the public from what they learn. Mycotoxins, the great masquerader of the 21st century. This is what the World Health Organization calls it. And so the basic principle that I want to pass on to you is base your diagnostic testing and treatment on medical and scientific evidence, not on popular so-called experts and what they say on the internet and these websites and blogs that have no medical science to them. So again, the key to solving problems, especially those caused by toxins, is first, detect the cause. Second, remove the cause. Third, repair the damage caused by the toxins. And mycotoxins, molds produce toxins known as mycotoxins. And these molds are always present in homes or workplaces, public buildings, etc., that are water damaged. And they're always producing mycotoxins. They don't rest. And mycotoxin exposure is far more common than we thought. In the United States, 85% of buildings have had past water damage, while 43% have current water damage. That means a lot of people are affected. 2 important points. 1, a mold that produces mycotoxins usually produces a series of mycotoxins rather than just one mycotoxin, okay? The other part is, if a mold that is known to produce mycotoxins is present in a home or in a building, indoor, anywhere, then the mycotoxin it produces is there as well. Makes sense, and it's logical. So hair size matters. Why? Because hair is 100 microns thick. Spores are 2 to 4 microns. Mycotoxins are 0.1 microns, the size of a virus. Exposure to mycotoxins is by inhalation and dermal absorption. Ingestion is minimal. There's so many people who think that these grow in the gut. They do not. And Dr. Weinstock, who is a professor of gastroenterology at Washington University School of Medicine in St. Louis, Missouri, and I published an article a year ago showing that. And if you want a copy, I'd be happy to send it to you. It's the last slide at the end. Okay, so chronic inflammatory responses to mycotoxins upregulate aromatase, the enzyme responsible for the last step in estrogen biosynthesis from androgens. In other words, testosterone converting it to estrogen. What does this mean? This affects testosterone. I'm bringing these hormones up because it's important to know, because I get a lot of questions because patients say to me, oh, I have autoimmune, I have Hashimoto's. You know, I have all kinds of menstrual problems. I have no libido, etc. Well, this is why. So here's another one. Affects interference in estradiol, testosterone, progesterone, increases in the progesterone and a decrease is in testosterone production. Penicillium toxin depresses the central nervous system. It's a hyperglycemic agent, more sugar, produces massive bone marrow depression. It's toxic to the liver and it's toxic to the kidneys. And it produces inhibition of the formation of sperm in the testes. Okay, so these things, as you can read, serum testosterone concentration were decreased. This is with deoxynivalenol, which is also known as vomitoxin. So the all these affect. Now here's the thyroid. Please read what it says here, and then I'll comment on it. Okay, I hope it was enough time. But the point is, this deiodinase enzyme, DIO2, regulates the activities of thyroid hormone, okay? And by metabolizing the precursor molecule T4 that is secreted by the thyroid gland. This step is inhibited by mycotoxins. And here is estrogen. So what certain mycotoxins are also myco, meaning mold estrogens. Their abilities include binding to estrogen receptors, confusing the pituitary gland as to the actual stores in the body of healthiest stuff of estrogen. So who wants an excess of estrogen? So these are some of the things. Here's ochratoxin. It impairs spermatogenesis. It's a very uniquely useful biomarker, ochratoxin, of exposure in your environment because it's high affinity binding to serum albumin. So for the blood, it binds to serum albumin, the number one protein of the body, albumin. So it's 99.8% bound to albumin. So it cannot be excreted through kidneys. And it says here that it's reabsorbed from all parts of the nephron by both active and passive transport and by passive diffusion. These are two studies that discuss this and show it. This is not something new in science. So what is the most precise and accurate test you can do to find out if your patient is suffering from the effects of molds and mycotoxins? You do an antibody test. Why? Because it's the most precise test available. Second, it's what university medical centers use. Third, it's because it is the standard of care to use antibodies when you're talking about something as small as mycotoxins. Remember, it's the same size of virus. How do you test for a virus? EBV virus, hepatitis virus, herpes virus, CMV virus. Do you use a blood test? Yes. Do you use urine test? No. Okay, there you go. So here's what testing looks like. Now, this person was pretty ill. This is a fake name, fake doctor, etc. But on the left, you have the IgE antibodies, which indicate mast cell activation. And on the right, you have IgG antibodies, which indicate a current exposure, that the immune system is currently fighting this. This is a quantitative test. It tells you how much. So how do you, I want to explain understanding antibodies, okay? There's 4 categories of pathogens. They're in microbiology: bacteria, viruses, pathogenic fungi, parasites. And we develop an IgG antibodies to these after an infection. Okay, and these 4 pathogens are living things, organisms. Okay, they have cell walls, etc. An IgG antibody to these mean past exposure. So for example, I had chickenpox as a kid, and I today have IgG antibodies to that virus because I had this when I was a child. Now, here's the big difference between these 4 pathogens and toxins in toxicology. Toxins are not alive. They don't have cell walls. They're a group of molecules. And antibodies to these toxins indicate current immune reaction, not exposure sometime way back in the past. And the other part is once the toxins are gone from the body, the antibody reaction fades away and the tests come back as normal. So it's a great way of following patients. It's a very effective way. So what tests should you order? If the patient is having any kind of respiratory issues, because molds can colonize in the lung, do a pulmonary function test. This means when they're having a chronic little cough, like just a little like this, or shortness of breath, tightness in their chest, etc. Do a pulmonary function test. If you're worried and concerned about their brain, don't do an MRI. Do a brain SPECT scan. First of all, it's 3-dimensional. It shows you what parts are under reacting and overreacting, and it gives you much more information than an MRI. And I'll give you an example. For instance, in an MRI, if I do an MRI on a patient tomorrow morning, Thursday morning, and on the brain, and that patient dies sometime over the weekend, and I do another MRI on the same patient when he's dead back on Monday or Tuesday of next week, there'll be no difference between the two. But there would be a tremendous difference on the brain SPECT scan. The person who really brought out SPECT scans of the brain as a hugely useful tool in the armament of medicine is Dr. Dan Amen, a good friend of mine. I've known him for many years before either one of us had any white hair. And great, brilliant man, wonderful person, wonderful human being as well. So what other tests should you order? I usually order serum immunoglobulins, IgA, IgM, IgE, and IgG. Now, for those of you who missed class that day, remember that IgG is divided into 4 subclasses, 1, 2, 3, and 4. I also will do an autoimmune panel at Immunosciences Laboratory because they're the premier antibody testing laboratory in the United States. They actually have tests that are patented. All the other labs do not. And I'll do a thyroid panel as I show if I'm suspecting thyroid issues because of the slide that I showed previously on how mycotoxins affect the hormones in our body. So in foods, there's low levels of mycotoxins, cereals, beans, fruits, grape juice, etc. Remember, coffee is a bean also. And this is all well known by the World Health Organization, United Nations Food and Agricultural Organization, the FDA, the EFSA, etc. For that reason, there's a tiny amount of urine, of mycotoxins in urine in normal, healthy people. So, for example, this is a study from not quite 2 years ago, from July 2021, by Frey and his group, that showed 1 of 4 mycotoxins were found in both pasteurized and unpasteurized milk from cows. So 91% of all the milk tested had at least 1 mycotoxin. and 30% had 2 to 4. However, all the mycotoxins level were well below TDI, tolerable daily intake, which means these were easily excreted in urine, as are most mycotoxins found in beverages and foods. So don't get hooked into that this comes from foods. The only place that can happen is certain countries in Africa and certain parts of Eastern China because of poor storage of grain after harvesting. So, as we showed earlier, that ochratoxin is 99.8% bound to albumin, and it's reabsorbed by all parts of the kidney. So its elimination by the kidneys through glomerular filtration is negligible. Yet I'm told by many practitioners that when they do a urine test, there's always ochratoxin. How can that be? Well, have them publish an article in a medical journal showing this, like this group of doctors did. Okay. And here is a study that was done in October of 2022, 6 months ago. And it says the variability of mycotoxins concentration in urine and its volume is based on daily intake, okay? So what happens if one day in the morning you went out and played tennis and sweated and are a little bit dehydrated? What happens if another morning you didn't do anything at all but, you know, have breakfast and read? Your body is going to be different. And so they say that you should do urine sampling at different time points during the day to see what your real urine excretion is of mycotoxins. And then they go on to say the inter-individual comparison of mycotoxins is challenging because various factors such as gender, age, diet, and muscle mass can influence creatinine secretion. And they went on to say that the ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. And I can tell you that that specificity at MyMycoLab is 97%. And here's the study. It's titled Analytical Validation of a Direct Competitive ELISA for Multiple Mycotoxin Detection in Human Serum. Is published in the journal Toxins, October 2022. And of course, the CDC says that urine is not a validated test. Now, here's tests with no medical evidence that they have anything to do with either molds or mycotoxins. The VIP, the MSH, the transforming growth factor beta 1, C4A, HLA-DR gene. By the way, this HLA-DR gene is said to affect 24 to 25% of the population. That makes it around 82 to 83 million Americans. Yet there isn't a single article in PubMed, which is about 35 million articles, published articles. There isn't a single one that says this. Okay, but I will tell you 82 million. Let's take that number. Let's take another disease that everybody knows about, and it's only 32 million, and it's called diabetes. So something with 82 million Americans would be all over the place, would be in the news, it would be in studies, it would be taught in medical. It's not. Then there's the VEGF, the MMP9, and the VCS. None of these have any basis in medical science. Okay. Treatment. Let's get into treatment a little bit. The first and foremost, the first rule of toxicology, get the patient away from the toxin or the toxin away from the patient. Second, after this happens, build back the immune system with supplements while giving the right antifungal. Now, here's the thing. If the patient doesn't get better with the correct treatment, it means they're still being exposed. Okay? And there's people who swear up and down, no, my home's clean and all this kind of stuff. You try to start treatment and they don't get well. So you have to minimize environmental exposure, pesticide exposure, heavy metals from seafood. Let them know, I mean, if they're going to eat sushi and raw tuna or even cooked tuna, swordfish, things like that, those all contain heavy metals. Those are well known, mercury especially. Processed foods, artificial sweetener, etc. All those are artificial food flavorings, colorings, preservatives. Let me tell you which food is high in heavy metals. Okay, crab, grouper, mackerel, marlin, orange roughy, salmon, bluefish, sea bass, Chilean sea bass, swordfish, tattlefish, and tuna. So some of you may be surprised by that, but it's true. Those are the ones that contain the highest amount of mercury and in fish. The lowest are cod, anchovies, catfish, crab, although they say blue crab has it, but a domestic crab doesn't. Crawfish, flounder doesn't. Haddock, North Atlantic mackerel is okay. Mullet, and then sardines, shrimp, sole, squid, tilapia, trout, and whitefish. Those are okay. They don't have mercury or very, very minimal amounts. Lastly here, EMF exposure. Some patients are real sensitive to that, so I'm making you aware. Okay, so here's a study by Hoff and his, who said, this is in Fusarium. I'll tell you a little more about Fusarium. So what he wrote is, one has to admit that today the risk for acute intoxications of humans is low, at least in developed countries, where the amount of mycotoxins in food items is controlled by authorities. That's correct. We don't have problems from the food. So food mycotoxins are not a concern, okay? Numerous studies have shown that these are below the TDI. That's the tolerable daily intake that's set by the FDA, the EFSA, which is the European Food Safety Authority, the United Nations Food, et cetera, et cetera. You can read that. So it's not, we don't get mycotoxins from food, contrary to what, if you just Google something and listen to Dr. Google, he's going to give you all kinds of opinions. Well, this is the real science. And here's another study. This was from a year ago, published in July of 22. Fungi containing foodstuff are still a global burden, affecting developing countries much more than developed regions such as the EU, European Union, where strict regulations are ensuring food safety. And that goes for the United States as well. Now, here's deoxynivalenol, vomitoxin. Oh, that comes from grain. I read on the internet that it's from grain. Well, let's just look at the last paragraph, the last 3 lines. An adult weighing 170 pounds would have to eat 14 pounds of ready-to-eat oatmeal or 20 slices of bread all at one sitting. And this is rancid smelly, taste awful oatmeal or bread for it to affect them. So no, we don't get this from foods, okay? Just so you understand. And I will tell you this because fusarium produces deoxynivalenol, also known as vomitoxin, okay? So you get on the internet, it tells you, oh, it's from grain. No, it's, and you just see it right here in front of you. That's not from grain. But fusarium is very, it's the mold that produces the most spores. It produces much more spores than aspergillus and penicillium and Stachybotrys, etc. So it's, you're going to have a lot more of it show up on a blood test than the others. Plus, on top of that, it's highly immunogenic, which means it really stimulates the immune system because there's a lot of it. And the immune system has really to fight it off. Okay, let's go on to treatment. So basic treatment is used in antifungal. Sporanox, 100 milligrams twice a day. For brain support, this is in your patients that have a lot of brain issues. What am I talking about? Brain fog, confusion, short-term memory loss, sleep disturbance, anxiety, depression, mood swings, those kind of things. Phosphatidylserine, 500 milligrams, 1 to 2 daily. Melatonin, 3 milligrams at bedtime. And B complex is called Therabee, and 5,000 international units of vitamin D3. These four, 1 through 4, I get from Claire Labs with a K. Okay. Now, the 5th one I give is nitric oxide. And I give, and that's twice a day. And what do you do? What does that mean? That means that you get it from N101. Dr. Nathan Bryan developed this. He's from Baylor. Great stuff. And as a result, it helps people because it vasodilates. We all make nitric oxide. However, nitric oxide diminishes by 10% with every decade of life. So we need more. So B complex, okay? It's 8 water-soluble vitamins, okay? And it affects a lot of different areas of the brain. Includes energy production, DNA, RNA synthesis and repair, genomic and non-genomic methylation, the synthesis of many neurochemicals and signaling molecules. And by the way, whoever's got that little red thing, please don't do that anymore. Furthermore, evidence from human research clearly shows both that significant proportions of the population of developed countries, when we are one, suffer from deficiencies or insufficiencies of one or more of the B complex, okay? And so we really need to do some B complex to preserve brain health. Okay, now, nitric oxide. It plays a key role by endowing the brain neuronal networks with the ability to make continual adjustments to function in response to moment changes in physiological input. And as I mentioned, it's a vasodilator, which means more oxygen getting to the brain. Now, vitamin D, D3, helpful for cognitive impairment, vascular dementia, Lewy body dementia, etc. All that, anything affecting brain cell malfunction or cell death. And if you have low vitamin D levels, and almost out of 10 patients that I see, 8 will have low or below normal levels. These are associated with increased cognitive impairment, diabetes, cardiovascular problems, cancer, respiratory disease. So now this is for body function support rather than brain. Okay, the first one was brain. This is body function. Magnesium. I get Mag SRT from Jigsaw Health. The vitamin D3 is from Claire. I get the Omega Q Plus Max. This was developed by Dr. Steve Sinatra, a dear friend of mine for 30 years who passed away last year, sadly. Probiotic, spore-forming bacilli. I follow the directions on the bottle. This is Megaspore Biotic. And vitamin C, 1 gram TID. You don't need vitamin C with this, with that, or with the other. Just plain old vitamin C. You can get it from Clear Labs. You need it 1 gram 3 times a day. Remember, this was all developed, vitamin C, and all the knowledge we have, a lot of the knowledge we have about it was developed by Dr. Linus Pauling, and he won the Nobel Prize twice. Magnesium, 11th most common element in the human body. Okay. It's needed in 350 enzyme systems, playing a role in the majority of the body's metabolic process. Up to 80% of the population are deficient in magnesium. And magnesium binding sites have been detected on almost 3,800 human proteins that are essential for building, repairing, maintaining body cells. So that's how important it is. It's a cofactor in ATP. If you remember way back, ATP, which plays a role in energy metabolism. And what does that mean? That's the processes by which the body breaks down proteins, carbohydrates, and fats, converting them into energy. ATP is the energy part, okay? And it's the primary product made by our mitochondria, which is our energy factories. It's required as a cofactor for vitamin C, okay? So if you don't have it, you're going to have problems absorbing vitamin C, but also look further down. The same is going to happen with zinc, potassium, vitamin B complex, calcium, and vitamin D3. Without magnesium, it would be difficult to absorb and use these substances. Here's what is contained in Omega Q Plus Max. DHA and EPA from squid, not from fish, because fish may contain mercury. L-carnitine, curcumin, a great anti-inflammatory, coenzyme Q10, which helps our heart muscle and circulation, and resveratrol, another great anti-inflammatory from the skin of dark grapes. Now, here's something important that many people may not be aware of. We don't make and we cannot store vitamin C. So we have to get it from an external source. Almost all fruits and vegetables contain some vitamin C, but you'd have to eat a lot to really get up to 1 gram 3 times a day. It helps in depression, especially in kids. It reduces uric acid levels. It reduces the risk for brain cancer, and especially gliomas, and it lowers your lipids. So I want to show you this. This is from Dr. Vujani's lab, and this is a pH meter. So you can see that Tropicana from Florida, where I'm talking to you from, 3.33. That's pretty acid, isn't it? Well, apple cider vinegar is 2.32. But here you go. Even more acidic are these two popular drinks. How do they make them palatable? By adding sugar or sweeteners, artificial. Okay, just be aware of that. I thought this would be interesting for you to see. So remember the gut. 80% of our immune system is in the gut. So this is a first place to begin. The main components will be diet, supplements, and probiotic. So use the spore-forming bacilli for probiotics, megaspore biotic. I'll tell you this, Dr. Simon Cutting at Reading University in London did studies on lactobacilli and bifidobacterium as probiotics. And he found that over 90% die in the stomach from the acidity that is in the part of the stomach. So he called it dead bacteria therapy because you're not getting anything to go to the gut and perform as a probiotic. Whereas spore-forming bacilli go right through the acidity without any problem. Now, diet, I would try gluten-free for 90 days. Avoid dairy, and I forgot to put on here, and avoid also soy. Okay. Supplements and other treatment. Remember, antifungal treatment. You can start with itraconazole, which is the generic, 100 milligrams twice a day with a little bit of food. And remember that generics come from basically India or China, and every so often, like just now recently in January, they had to take an antihypertensive blood pressure medication off the market because they found some things in the pill that shouldn't have been there. And this happens regularly. You remember Zantac, okay? Well, they found that the coating had some cancerous agent in it. So you can't buy Zantac anymore. It's gone. The other, so if a patient has any difficulties, they say, I feel queasy or whatever with itraconazole, give them Sporanox, the name brand, because that is the purest form. The other thing that, if it's possible, infrared sauna. But here's the key. Start low and go slow. Increase it bit by bit. Don't jump in there and spend 2 hours daily. You're going to feel terrible. I just want to show you this. I've shown it before. This is SIBO on the left, June 10, 2021, pre-itraconazole. Then September 12th, 3 months later, on itraconazole. You see the difference? Okay. So let's talk about treatment, because a lot of practitioners out there don't bother reading the medical literature. So I'm going to provide it here for you. Itraconazole versus fluconazole for prevention of fungal infections in patients receiving these transplants. So this is what they looked at. Prophylactic fluconazole prevents candidiasis. However, this drug has no activity against molds. And itraconazole appears to prevent invasive mold infection, which is what we want. Here's another comparison, okay? Fluconazole did not reduce the fungal burden in secondary sites, the lungs and the kidneys, whereas this itraconazole dose was more effective in clearing fungi from both organs. Itraconazole was superior to fluconazole in clearing the fungi from the spinal cord and the lungs. Overall, itraconazole was more efficacious on a milligram by kilo basis. So there's two types of molds, single cell and multiple cell. Single cell are yeasts like Candida, and the effective treatment is fluconazole for yeasts, diflucan. It does not affect multiple cell molds. Itraconazole, known as Sporanox, is effective against both single and multiple cell molds, such as Aspergillus, Stachybotrys, penicillin, etc. So you can see in these two columns what happens when you prescribe fluconazole versus itraconazole. Now, itraconazole, because I get this question, oh my God, it's going to destroy their liver, it's going to destroy I don't know what, and all this kind of stuff. Okay, that's not true. That's false. So itraconazole, this is from a study published in 2017. Itraconazole, also known as Sporanox, is a common antifungal agent that was developed in the 1980s. It has been in clinical use for 35 years with an established safety record. So here's a study this is looking at fusarium, and fusarium produces the mycotoxin, vomitoxin, which is also known as deoxynivalenol. And these clinical diseases are rather difficult to cure by antimycotics, whereby the azoles such as itraconazole, voriconazole, and liposomal amphotericin B give relatively the best results. Amphotericin B is for nasal spray for people who have who are affected in their nasal sinuses and paranasal sinuses. Here is a title of a study. Voriconazole pharmacokinetics are not altered in critically ill patients who have acute on chronic liver failure and continuous renal replacement therapy. So it's safe in people who have chronic liver failure and are waiting for kidney transplant. And yet on the internet, oh, you should be very careful with, well, here's the studies. Here's the medical and scientific evidence. Another key thing, if a patient develops new symptoms while undergoing treatment, it usually means new exposure to molds and mycotoxins. Be aware of that. Please do not use glutathione in patients who test positive for gliotoxin. Read what is underlined. Glutathione promotes gliotoxin-induced cytotoxicity. This is from a study published in 2006. Okay, so NAC, glutathione know if they have gliotoxin. If they don't have gliotoxin, it's fine. But as long as they have gliotoxin antibodies in their blood test, don't give them glutathione or NAC, the precursor. Okay. Important. Retest after 6 months of treatment. What doesn't help? HBOT, hyperbaric oxygen, IV ozone, IV treatments with vitamins. Why? Because I see patients who come to see me after they've been to, I don't know how many doctors have had all these IV treatments and HBOT, etc. But there's no medical evidence in published medical journals that these have any effects on either molds or mycotoxins. Okay, binders. There's been animal studies in pigs, rabbits, sheep, broiler chickens, ducks, turkeys, rats, and mice that certain specified binders may take mycotoxins out of the gut under certain precise laboratory conditions, because these animals were in laboratories. However, there are no medical or scientific published studies to support their use in humans, except for one. This is the study that I was able to find. Binders rely on the absorption of mycotoxins from the gut, preventing it from getting into the bloodstream. Remember, the old, what you hear all these people on the internet, pull out, use this binder to pull the mycotoxin out. Okay, well, that's a bunch of hogwash, because they looked at all these clays, activated zeolite, bentonite, blah, blah, blah. They're effective in neutralizing aflatoxin, which is rare, very rare. They're ineffective in all other mycotoxins. In addition, they also bind vital vitamins as well as macro and micro elements. So I've had some people argue, yes, but you have to give it 4 hours or or however many hours before they eat or after they eat or before they take supplements or medication or after, etc. Show me a study that says that's correct. There are none. There are no studies that say they won't bind vitamins, etc., except for this study. Now, it does affect and neutralizes aflatoxin, but how common is that? So this is looking at HVAC ducts, refrigerator compressors, and HVAC filters, etc. And you can see all the different parts on the left-hand column, and aflatoxin, ochratoxin, and trichothecenes. Look at aflatoxin, 0. So why take a binder if you're not going to get anything? Okay, so this is looking at vomitoxin, also known as deoxynivalenol, and we already looked at this, so we don't need to see it again. What is not a valid test for mold? The oat test. Okay, it measures levels of organic compounds in urine. Okay, it's used to check for rare inborn genetic defects of metabolism in newborns. There is no studies that say it tells you anything about molds. And that's the medical and scientific evidence. What can help you determine if your patient is suffering from the effects of molds and mycotoxins? It's the patient questionnaire. I've developed it over 30 years, and it's a great tool to help guide the clinician. Includes the first 2 pages, which is basically symptoms commonly found in patients suffering from molds and mycotoxins. And on the left, you have all the symptoms on 2 pages. On the left-hand side, there's a column that says, score it from 1 to 10. The patient has to score it, okay? Fatigue, 1 to 10. What's your score? Well, it's 8. Okay, that's what that patient wrote, okay? On the right side, you fill when it first started. So they'll say, okay, it started in 2020 or 2021, 2022, or whatever. Then the next time you see the patient, you have them fill it out again, because this way you can follow what's getting better and what's not. Very simple to use. So here is an example of it, okay? So on the left, the severity of the symptoms. This is just the first page. And the second is, when did you first notice this symptom? It's a great screening tool. The take-home message: if you have a patient that's been diagnosed with chronic fatigue syndrome, fibromyalgia, chronic Lyme disease, or has an autoimmune disorder, and that includes Hashimoto's thyroiditis, who has seen a number of clinicians, had a number of tests, a number of treatments without relief, and continues to be ill, think of molds in the home and or in the workplace, and mycotoxin. Test for the mycotoxin antibodies at MyMycoLab. So, if you would like some more information, send me an email at immunedoctor@gmail.com. Okay, if you want the patient questionnaire, I mentioned to you that Dr. Weinstock and I wrote this about the gut and the brain and misconceptions. Also a study that I published back 4 years ago now, Lyme disease and mycotoxicosis. How do you tell between them? Is it really Lyme or is it really mycotoxins, or can you have both? Okay. And if you want any references, although most pages had references, email me. And of course, please, if you have any questions, this is your chance to ask them in the chat. So please chat away with your questions. Boy, I must have done a really good job because nobody's putting any questions. How long do I recommend giving itraconazole? And what are the main side effects? So I recommend more or less 6 months. And what are the main side effects? There are none. As you could see from the slides, it's safe. There are no main side effects, okay? And the other question is, do I use immunosciences for IgG heavy metals? No, I don't. I use Cyrex, okay? And Cyrex does a good job for antibodies to all kinds of toxins, okay? And the question now is, do I do a test for SIBO, or do I just treat and it's resolved? I just go ahead and treat. I mean, it's obvious. Look at the girl. Do I need to test if she has SIBO? Of course not. She's showing me. She looks like she's several months pregnant. Okay. What do you consider to be the range for optimal vitamin D levels? 50 to 80. Okay. Will one itraconazole a day clear mycotoxins out? No. No, the half-life is shortened. By the way, itraconazole crosses the blood-brain barrier, which is very important to know, because a lot of this happens in the brain. So, you need 100 milligrams twice a day. Now, I didn't show this because of time constraints, but there are studies that show up to 400 milligrams a day is perfectly fine, no side effects, no medical problems, etc. Any other questions? Go right ahead. Feel free. I'm open. Are there any lab tests worth monitoring during treatment to know if the patient is improving, especially for a patient who aren't improving with outwards symptoms? Well, in my opinion, usually by 10 weeks, 8 to 10 weeks, they are starting to feel the difference. If they are not, they're still getting exposed. What can a clinician learn from also testing IgA and IgG, the four subclasses, IgE and IgM? Basically, I only use that because I'm an immunologist, and like, for instance, 2% of the world population is going to be deficient in IgA. To me, that's interesting. I use, because the IgE is important because you won't believe, but there are some people whose IgE is off the chart. And so they're more likely to have a lot of allergic reactions. So that's helpful for me. IgM, I just want to make sure they have decent levels of it. I have one patient with slight increase of LFT on itraconazole, up to doesn't drink, not using other RX except Zyrtec. I would say, what supplements do you have them on? Does itraconazole treat candida? Yeah, let me show you this slide again. Or was it? Nope. Here. Itraconazole treats candida and all the others. After treatment, do you see the hormones regulated back to a normal range? Absolutely. I see in men, testosterone levels come back up to normal. In women who are at the age where they still menstruate, all of a sudden their menstruation is normal. Then I also see that their thyroid is back to normal. All these things. Have I found supplements that affect LFTs? Well, I found that supplements can affect LFTs. I use the labs that the places that I mentioned for my supplements, because I think that those are really good labs. So, etc. But I've seen patients who are given 20 30 labs, 30 different supplements. So in this case, your patient is taking on D3 phosphatidylserine magnesium with the one with LFT. Okay, so let me go back and see what a slight increase. I'm not worried about that, but it's worth checking. So this is where you might want to get them off itraconazole and put them on Sporanox. When histamine gets to be a problem, okay, do you treat this? Yes, this is the IgE. IgE stimulates mast cells to release pro-inflammatory cytokines. So that's where you need H1 and H2 blockers. What are they? They're very simple. It's like giving them, I don't know, Axid and Zyrtec or something. That's fine. Both of them block our H1. The first one, Zyrtec, is an H1 blocker. You know, Pepsid is an H2 blocker. I give them the small dose, smallest you can. Can children take itraconazole? Absolutely. The youngest I've given it to is 3 years old. Also, you know, when you do the test by MyMycoLab, you get a Zoom call with me to go over the test results. With then with tremor, are you adding anything to the mentioned protocol to repair the myelin sheath? The myelin sheath is basically repaired by phosphatidylserine. So this is when I go to either twice a day or even 3 times a day. But it takes a few months for that to start working. It doesn't happen overnight, or it doesn't happen in the usual week, 2 weeks, 3 weeks. It takes 2-3 months to start doing that. At what age do you start testing children mycotoxins? Age 3. Up to, you know, in the 100 years old. More than 100, actually. Any other questions? If mold illness starts in the sinuses, do you treat that same as itraconazole in a child with fungal infection? No. If it's in the sinuses, you treat it with amphotericin B nasal spray and itraconazole as well. Is the fungal infection in the body from inhaling through the sinuses? Here's what a study showed. It was done by Dr. Ponikow, chairman of the Department of ENT Surgery at the Mayo Clinic. He took 210 patients who had chronic sinus problems, took them to the operating room, cleaned out their sinuses, sent it to the lab, and the lab reported that out of the 210 patients, 96%, what they found was mold. So he did itraconazole and amphotericin nasal spray, and it worked great. How long to treat with antifungals? It was asked a little bit ago, and that's 6 months in general. What strength of amphotericin B and how long do they need to use it? It's amphotericin B is a 0.5 nasal solution, and I usually use it for until they clear up. Usually it takes 4 months but sometimes 6 months. And here's a comment. I had a stomach fungus treatment with itraconazole and my neuropathy improving. Wonderful. That's great news. 0.5 or 0.05? 0.5. Should you have your LFTs checked every so often while on itraconazole? I recommend it every other month, every 2 months. Nasal spray is taken 2 squirts in each nostril twice a day. When are imaging studies helpful? MRI, NeuroQuant, SPECT scan. NeuroQuant is a volume, so it's a good test if you're worried about a patient having one, Alzheimer's disease, or 2, having had traumatic brain injury. They fell off their motorcycle or had a wreck or something. That's what NeuroQuant is. MRI is okay if you're looking for demyelination. SPECT scan is the best one if you want to see how the brain is functioning, because it's 3D and you get to see all parts of the brain. .5 nasal solution. We're getting to the bewitching hour. If you have any questions, don't hesitate. How long does one usually have to take? Okay, this is one that, how long does it usually take for itraconazole to clear out the mycotoxins mold? 6 months. Can fluconazole substitute for itraconazole? Let me show you the slide so you can see it again if you didn't catch it the first time around. So no. Here's the difference between fluconazole versus itraconazole. Is 100 milligrams itraconazole 2 times a day too much? No, it's the right dose. It's the correct dose. 100 milligrams twice a day. And it's been in clinical use for 35 years with an established safety record. And you can give it to people who have liver failure and kidney failure. See that? Any other? If someone's symptoms are better, say in 4 months, would you stop treating or treat for? No, you need to treat it for 6 months. The textbooks say 12 to 18 months. How long do we recommend the supplement? As long as they are on the itraconazole or the Sporanox, they should be taking the supplements as well. For folks in their 70s, do I treat different? No, not at all. I'm in my 70s. Have you found any changes in prevalence or presentation related to pandemic or vaccine? Yes, actually, there's talk now in scientific circles that the post-COVID syndrome is actually because people stayed at home and didn't go anywhere, and their house had mold and they're not getting well. And actually one paper now found that if you give a long COVID patient itraconazole, they get better. Yes, correct. It says here, Dr. Campbell told me once the side effects of taking itraconazole are good health. That's correct. Do we need to check liver? As I just said a few moments ago, I would recommend checking every 2 months your liver function test. If you suffer from severe reactions with food, what do you recommend till you get better? Like you choke on all your foods. Well, I'm not sure how to answer that. Here's one. If most of the MyCoLab results are IgE, does that mean they still need itraconazole? Absolutely. Have Bad cook. So yes, because both indicate a reaction to mycotoxins, and you want to get rid of those mycotoxins. Taking itraconazole to clear the molds and mycotoxins can help clear up the gut. Absolutely. So I need to show you that gal again, who was treated by one of the most amazing clinicians I know in Idaho. And she's in Idaho, but she's one of the most clinicians I know. Will this recording be available later? Yep. These are all taped. Is there any chance Medicare or any insurance will cover MyMycoLab? MyMycoLab is a fee for service. We receive serum from all 5 continents. I'm not going to go chasing an insurance company in Cambodia or Crete. Or for example, Texas has 31 different Blue Cross Blue Shield plans. No, we don't deal with that. Have you treated pregnant mothers with itraconazole as well? No, you cannot treat with itraconazole during pregnancy. Breastfeeding is okay. Remember that if you have mold, ochratoxin, and you're pregnant, ochratoxin will cross the placental barrier and potentially may affect the fetus. The other thing is ochratoxin will come out in breast milk. Well, yes, thank you. Thank you. You're welcome. Okay, I think we can get done here, and let's call it a night. Merci beaucoup. Avec plaisir, mademoiselle. Which company sells magnesium? It's called Jigsaw Health. Is chitomium a gliotoxin? Chitomium is a mold, gliotoxin is a mycotoxin. But yes, part of the mycotoxins tested by MyMycoLab include the ones from chitomium. Do you routinely check for Lyme when doing a workup? No, but I will tell you this: if you have antibodies to any toxin, you will automatically light up for any of the viruses. You will also be positive for tests for Lyme, although you don't have any of the viruses and you don't have Lyme. All righty, folks. So take care. Good night, everybody.